Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Jay Calvert, and I am here today with Dr. Millicent Rovelo. Millicent, how are you doing?
I'm doing very well. How are you?
I'm doing great. I'm really happy to be here with Orla.
Yes.
From the Rock Spa.
Yay! Welcome, Orla.
I'm back.
That's right. We are glad you're back because we have more to talk about, lots more. We want to talk about today with you, and just for everybody who's kind of tuning in for the first time, Orla is the PA, the physician assistant. Like if you say PA in Hollywood, people think like production assistant
or production assistant.
Yeah, and you're getting coffee for Robert De Niro. But that's not what she does. What Orla does is...
Maybe Robert De Niro is my patient. Just kidding.
Right. And obviously not HIPAA. So we're going to talk today about one of the procedures that Orla does for her patients, which is microneedling.
Yes.
And microneedling is kind of a great thing. It does a lot. So give us your overview of microneedling.
So microneedling is a non-invasive resurfacing treatment with minimal downtime. And what it is it's basically, I call it like a pen that you use that has tiny little needles that vibrate all over the skin, and you're causing trauma to the skin. And there's different depths that we use to, depending on what we're trying to treat. But it causes a trauma to the skin, and then your body responds by sending, macrophages and tries to heal the wounds that we've just put into the skin. And in turn, what they have found that it will help to minimize pores. It'll help with fine lines and wrinkles. It'll help with acne scarring. It even helps with a little bit of pigmentation. So it's great. Like, I've been using it a lot for people that have melasma.
Yes, very key.
Because typically with melasma, we can't really use lasers because it can make it worse.
Melasma being that brown pigmentation.
It's an overproduction of pigmentation. There's multiple reasons why people get that, and that could be another podcast that we could get into just alone. But yeah, it's a great procedure. A couple of days of downtime. People love it. They love the way that their skin looks afterwards.
Yeah, they do. They go crazy over microneedling.
It's not
that expensive. It's not like a laser.
Not that expensive. No, yeah. It's sometimes it's cheaper than laser. But you do have to do multiple treatments to kind of get the ultimate results with it. And you will see a lot after one, but depending on what we're treating, we do recommend to do multiple treatments, and then get yourself on a maintenance program and do that, a couple times a year. And, everyone likes it. So.
And you use it for scars.
Use it for scars.
That's really key.
Yeah.
I mean, I've liked that for like my rib harvest scars.
Right.
The mark of Calvert. You have a revision rhinoplasty. You get this little cut over the 8th rib. But yeah, those scars tend to do really well, but they do even better when they get microneedled.
Microneedled, yeah.
Well, it's the whole thing, like you said, you create the micro injury, then the inflammatory cells come in and the macrophages, and all of them, their whole goal at the end of the inflammatory period is to lay down collagen. Like that's the ultimate.
Yeah, it's a collagen
induction
process. It's a collagen induction therapy. So it's causing, that collagen to be stimulated so that it causes, the pores to be minimized, the fine lines and the wrinkles to be minimized. And it does a lot it's a great treatment. And, with the minimal downtime that you have associated with it, it's just a very popular treatment, especially now.
Yeah, I mean, a lot of people get microneedling and they love it.
Yeah.
So what can the patient expect coming in, first time microneedling? How would they do it? What can they expect? Pain, time, etc.
So after we do a consultation and we determine they're a good candidate for it, then they would... Basically, the whole process is they come in, they sign a consent form. We typically use topical numbing cream because for some people it's a sensitive procedure to do. I don't know if you would want to get stabbed with tiny little needles in your face, but
there are some people that would sign up for that.
Yes,
I'm sure there are.
Yes.
But if you're not into that sort of thing, we'll use the numbing cream.
We'll use the numbing cream, yes. So they numb for about half an hour to 45 minutes, depending on I also have this great machine if people are really, really hate needles.